This is the COVID update for October 27th, 2020. I'm Mike Good, CEO of University of Utah Health. Unfortunately, today our report shows continued high transmission of the coronavirus, both in our nation and in our state. First, the national chart, and as you can see, we've now had several days here where we've had more new cases of coronavirus in the last few days than we had back in the peak of the previous peak in July. And even our 7-day rolling average now is exceeding where we were in July with the number of new cases in our country. We do see a slight uptick in the number of deaths from coronavirus, still hovering in that 800 to 900 area. Recall that you first have increase in cases, then you have increase in hospitalizations, and then you have increased deaths about 4 to 6 weeks after the initial increase in cases. Similar and even more severe trends here in the state of Utah. Clearly our highest daily new coronavirus cases experienced over the past week, and a 7-day rolling average now of approximately 1,500 cases per day, really eclipsing where we were in July. The deaths from coronavirus have come up from this 1 to 2 per day to 4 to 5 per day. Fortunately for the last week, it has been steady. But again, all of our trends at the state and the national level heading the wrong way. This is a new slide that combines a lot of information into a single graphic. There's a lot here, so I'll take a few minutes and explain it to you. First of all, the horizontal bars that we'll focus on over here in this area. The horizontal bars are the number of new coronavirus tests each day. So in other words, the 7-day rolling average of new positive coronavirus tests, both those determined by PCR and those determined by antigen tests. So again, most of our testing shown by the lower gray bars here from PCR tests, but with increasing numbers of antigen tests also being reported now. And as I said before, a 7-day average of about 1,500 new coronavirus cases being diagnosed each day. So that's what the bars represent. The lines moving through the graph show the number of new hospitalizations, the total current hospitalizations, and those that are in ICU beds. So let's go down, and we see that here we're now experiencing around 40 additional hospital admissions each day for coronavirus throughout our state. Patients are staying 8-9 days or so, and so that means the number of individuals in the hospital is shown on the orange line, and we have about over 300 Utahns in Utah hospitals today with coronavirus. And then the red line in the middle shows the number of coronavirus patients in an ICU bed in the hospital. And again, both the total hospitalizations up over 300, well above where we were at the previous peak in July, and the approximately 110 patients that are in ICUs, again, also now eclipsing where we were in July. So again, multiple signs, multiple signals from the number of positive tests each day to the hospitalizations, the ICUs, and the deaths from coronavirus all increasing. With the virus increasing, no surprise that our reproductive number remains above 1. In fact, if you look at all this so-called area under the curve, so the line is the reproductive number, the dashed line here is 0. Anytime the reproductive number is above 1, that means each person with coronavirus is infecting more than one other individual. Now, fortunately, it's not 2 or 3 subsequent infections as it was back at the beginning of the pandemic. But even here at this 1.5, 1.3 and a half, if the reproductive number is 1.5, that means 2 people infect 3, 3 infect about 4.5 or 5, 5 infect approximately 9 or 10, and you can see how the spread of the virus then moves through our community. We are now seeing all age groups increasing. This is the number of new cases per 100,000 population. It's a way that at the national and the state level, we keep track of the virus and its spread. And you can see we've after a lull here, even the 15 to 24-year-old group is increasing, 25 to 44, 45 to 64. Of course, these groups start to worry us because this is where we see many of the hospitalizations. And in this group, the 65 to 84 and 85 and older, these are the groups where we see mortality from coronavirus. Teenagers also increasing. Only the infants, probably the only group where it appears more or less stable at this point. So the virus is spreading, and the virus is spreading in all age groups. This also is a new chart. Many have asked, well, aren't the positive tests just related to how many tests you do? So this is just our University of Utah Health, our clinics, and it's for symptomatic patients. And so the bottom chart shows you both positive and negative. In other words, the height of the bar, both colors, shows how many tests we did in University of Utah community clinics for symptomatic individuals. And you can see that we've been for more than several weeks now, almost the whole month, we've been charting more than 800 tests on average on a 7-day rolling average. And even though our testing capability is constant, our number of symptomatics is increasing. Our number of positive tests among the symptomatics is increasing, now also reaching a new high of 180 on a 7-day rolling average, a very high number of positive tests. So in other words, out of approximately 800 people that we test each day, 180 of them are testing positive for coronavirus. Or stated another way, if you have flu-like symptoms, shortness of breath, fever, cough, upper congestion, and so on, there's about a 1 in 5, 1 in 6 probability that you do have a coronavirus infection. So just another sign that the virus is spreading in our community. With more cases come more hospitalizations, and we've also seen this at University of Utah Hospital. Again, a new high for our 14-day summation of admissions. Yesterday we had 13 admissions, which tied our all-time high just about a week or so ago. With all of these admissions, our census has increased quite high, and we actually now have over 50 coronavirus patients in University Hospital, which is also an all-time high. We saw this curve last week where we got up to 250 patients in the hospital, saw a few days where it declined a bit. Now we're back up at 50. We talked last time about the ICU patients in red and the patients on the medical ward in gray, light gray, coming together. But since that time, more of the recent admissions have been to the medical ward. So still sick individuals who need to be in the hospital, but fortunately not as sick so that they need to be in the ICU. So about 20 patients in the ICU, about 30 patients on the medical ward at University of Utah Hospital. And again, I really want to acknowledge and thank our doctors, nurses, respiratory therapists, aides, everyone on the healthcare team, including our medical residents and our medical students, our nursing students, the health profession students. We've got everybody working exceptionally hard to provide care, not only to our coronavirus patients, but to all of the patients who need our care. We continue to see a very low level of transmission in the University of Utah campus. Our 7-day rolling average is about 14 individuals. Through our various reporting mechanisms, whether it's self-reported illness, students that are testing positive in both our symptomatic and our randomized asymptomatic testing programs, just a variety of ways we keep track of our campus. And remember, this has been in the 20 to 25 range. It's actually come down a little bit higher in our most recent daily report, but overall, a very low level of coronavirus on the University of Utah campus, and really want to acknowledge Senior Vice President for Academic Affairs, Dan Reed, and a large team of individuals, the deans of our colleges and schools, and our faculty, and our students, who have all come together to make sure our classroom settings have physical distance, that masks are worn, that hand sanitizer is used frequently. Very proud of the University of Utah and all that is happening to keep our in-person instruction happening as our fall semester continues. And so again, I'll close with reminding you, last week we reviewed in detail the new classification system in Utah, which categorizes counties as high, moderate, or low levels of virus transmission. Clearly, Salt Lake County is in a state of high virus transmission, which means masks are mandatory, and social gatherings, including family gatherings, gatherings of friends, need to be kept small. The best way to not catch this virus as an individual, the best way to not catch this virus is to stay apart from other people and to make sure you are wearing a mask whenever you are anywhere close to another individual. So we repeat the basics, the importance of face masks, hand washing, physical distance. Please stay at home and isolate yourself if you have any flu-like illness. Right now, if you have a flu-like illness, there's about a 1 in 5 chance you have coronavirus. So isolate yourself, get in touch with your physicians. But again, work very hard if you get coronavirus not to share it with others. And again, we need everyone wearing masks. We have to get this virus transmission slowed down because we are, as I've shared, kind of right on the edge of the capacity of our health system to provide care for everyone who needs it. Based on the experience of the faculty and staff at the University of Utah, I'm confident we can do this, but now is the time. We need everybody's help. I thank you in advance.